Hello, my name is Rich and I'm the service lead for the Staffordshire and Stoke-on-Trent ICS Staff Psychological Wellbeing Hub, and we support all health and social care colleagues across the ICS. The Staff Psychological Wellbeing Hub supports the overall wellbeing of all of our health and social care colleagues across the Staffordshire and Stoke ICS. Anybody who's struggling with any aspect of their overall well-being, whether it's feeling stressed, overwhelmed, whether it's work-related, whether it's home-related, quite often it's both, can self-refer to our service. And what we can guarantee is that sort of safe, confidential space where people can just open up, sort of untangle everything that's going on, and just have that conversation really, and really try and dig down into why they're feeling the way they do. And then we can offer that sort of listening ear, we can offer that empathy, that care and compassion to that individual to make sure that they feel listened to, make sure that they feel heard. And then from that point, we can actually refer on to additional support services that are available as well. So they might benefit from some staff support and counselling, some staff psychology, from the wellbeing services, and we have close connections with them and can make sure that they get that support. So I think sometimes when we are struggling, when we are feeling stressed, when we are feeling overwhelmed, we let ourselves get to the point where we almost become burnt out. At that point, we feel we've got to make sort of drastic changes, like it might be that we need to change our job or leave a job. It might be that we need to leave a partner that we're with, or it might be we're struggling financially and that we need to take out a loan. When actually, if we look a bit more inwards and look at things that we can control within ourselves and have these conversations, we often realise that it's the way that we're feeling and that we can do something about that. And through accessing the hub, what we do is make people realise that it's okay to feel the way they do. And not only that, but we normalise the services that are available. So we might talk about staff support and counselling and explain to that individual that that's exactly what this service is here for. And we can actually try and get people back on track, get people feeling themselves again before it gets to that stage of feeling overwhelmed. Being a new service and not really being known across the system, or not being known at all, we've done lots of outreach and engagement since day one. So we have had stands up outside of hospitals, handing out flyers, posters and all sorts of freebies. We've attended away days, conferences, we've done drop-ins at GP practices, drop-ins at care homes, we've done emailing lists, we've posted out hundreds of letters to different primary care GP practices, different care homes. So we've done lots of outreach and engagement, just trying to get people to realise that this service is here. This service is here for them and to support them. We've had a real focus recently on primary and social care, recognising that there isn't as much support there as there is for some of the other organisations, and also that it's harder, I'd say, to get that message across to people being sort of scattered across the patch. So more recently we've got an outreach and engagement lead who had a real focus on attending the practice network managers meetings, the care home managers meetings, and really sort of engaging people across social care, across primary care, and really start to get that message across. We've tried to grow the service really and offer more to our colleagues. So we deliver a weekly workshop which has become really popular. We tend to get 30 or 40 people attending a session. We deliver them on a Tuesday afternoon and Thursday morning, and they're a different topic every single week, anything from sort of compassionate leadership to psychological safety. We've had feedback that people see that as their 1 hour a week to themselves and use that as part of their self-care plans. We also have a carers network, which is a peer-to-peer group where people who are unpaid carers working across the system can come together and talk about some of the challenges that they face. And we also meet monthly as well. We've developed a financial wellbeing toolkit. We've developed a veterans toolkit. At the moment we're doing some work with Be Well Midlands and producing some sort of EDI toolkits to support people from sort of more minoritised groups really, and making sure that they're getting equal wellbeing support as well. Okay, so I'd like to share a piece of feedback that we received from one of our staff members who utilised the hub recently. So I honestly don't know if I would be in the same place without this service. Spending your career as part of a healthcare service is not easy. This service has made a significant impact on my career, well-being and life. I hope we, as the NHS, are never in a position in which this service isn't available, as it has enabled me to continue working for my trust, which I don't think would be possible without the incredible service I received and the incredible woman that supported me throughout my journey. From the bottom of my heart, thank you.